My name is Malini Govender and welcome to In the Pod at the Smile Bar.
Hi, Teri. Welcome to In the Pod at the Smile Bar.
I love it.
Do you get it? Podcast.
I'm in the pod. I promise you, these are so comfortable. I almost fell asleep in it when I was having
A
my
lot of
tea.
people do.
I was like, I need one of these for home.
I saw you had your earphones on,
Yes.
listening to music.
No, I was listening to podcasts.
Podcast.
So thank goodness you guys have the Wi-Fi here. So I was like, quickly went on my Spotify. I went to the TED Talks and I was like, what am I going to watch? So I listened and I watched about the TikTok. You know, the TikTok CEO, he recently went to Congress and they interviewed him about, obviously, a couple of the questions on there. It was very interesting to me. And the next one was so random. I was listening to about polar bears and how to protect yourself from polar bears. Like if I'm ever going to need to be in that situation.
I don't know how cold it gets up at waterfall, but
freezing.
They're polar bears.
Freezing.
Well, thank you for being here with us today. So, Teri, we want to talk to you about, I know you've just come off your active aligners treatment and we saw your stories and that you're very happy with it. So we wanted you to chat just about the journey and how you felt from the time you started and the expectation until the end result.
Yeah, I mean, it has been an amazing journey and thank you so much for taking me on this journey with you guys. I'm in my 30s.
You don't
telling you that, but don't tell everyone that. And I never thought that I have the opportunity to straighten my bottom teeth. When I was young, I had full braces on when I was about 10. I was rather young when I had them put in. And I never really wanted to go on that route of having braces again. I think anyone, if you've had braces before, you'll know exactly what I'm talking about. It can be quite involved experience and it can be quite shifting of your whole lifestyle.
Yeah.
So your whole lifestyle revolves around having these braces in, certain foods you can't eat,
cleaning them,
worried about them.
Yeah.
You know, it's a deal. And then when
they're just not pretty, let's be honest.
No, they're not pretty. Yeah. They're not pretty, and it's not uber affordable to get those clear ones, and you can still see it. And for me, someone that is very active on social media, I take photos, I'm doing videos. I didn't want to have something that would distract from what I'm doing. So when active aligners came along, I was like, wow, this is like literally a dream come true. It's perfect. It fits into my lifestyle. I can wear them, take them out when I need to, talk, eat.
That flexibility is quite nice.
100%.
Yeah.
100%. And I didn't expect it to be as easy as it was. I think everyone can get a little bit intimidated with them in, and the flexibility was 100% there. I didn't have to give up any food, which is important.
Yeah, of course.
You know, because I remember when I used to have my braces, they're like, no, you can't eat apples, you can't eat popcorn, you can't have biltong, you can't have this, you can't have all of these foods that you like, because they're going to influence your teeth and break your braces.
And your total treatment lasted?
About 6 months.
Okay.
And I noticed the results in my teeth like within the first 2 weeks.
Wow.
So I was at the Family Dental Care Group at Link Hills with Dr. Govender, and I remember WhatsApping him and being, am I supposed to be seeing results now already? Am I like imagining this? Am I
like an overachiever?
Is this like meant to be happening? He was like, yes, it can happen that quickly.
Yeah.
So I was really like shocked, but also it was really quick and easy. The whole process was good.
Amazing. And now you're at the Smile Bar. You're here to whiten your teeth. So it's part of the process. So we have something called ABC. Do you want to tell everybody what it's about?
Now she's going to test me on whether I know my ABCs.
You remember what it stands for.
So first of all, your ABC is your aligners, correct?
Correct. 5 points.
5 points for me. So aligning your teeth first. But it's not as quick and easy, simple as that. I just want to quickly dive into something. So with your aligners, and the benefit of having it with Family Dental Care Group is that you have someone that walks you through the process. There are other products on the market that you can literally buy off the shelf, put them in your mouth, and they tell you that you can straighten your teeth, which is not exactly it. I mean, I was amazed at the technology that Active Aligners has, where they do a proper like full 3D scan. I was like, what? This full 3D scan of my teeth.
The technology is phenomenal.
Exactly. And I think you have to understand like that AI technology that can automatically tell you exactly what your whole journey is going to be and how your teeth should
Step
move.
by step.
And putting those little, I think I call them buttons on your teeth to help where the pressure points are going to be to move your teeth. And then do some dental shaving on some certain of the teeth to help with the movement. And I look at these other competitors on the market that have that you can just buy it off the internet, order it, and you can just put it in your mouth straight away. And I'm like, well, not everyone's teeth is the same.
Yeah.
Not everyone's jaws, the way you breathe, where your tongue is positioned, and all of that is taken into account. And he like literally walked me through the journey. He was so invested in my whole process, which I think is so important because I had someone to ask
Well,
those
because it's
important questions.
such a novel treatment, also there's a lot of questions and a lot of skepticism, because like, can something happen in 2 weeks? Can this happen without having the metal? And so we have a lot of patients who are skeptical initially, but once they see it, it works like magic.
Yeah, exactly. It is, magic is exactly that. And the fact that I could still go out to dinner, take my active aligners out, I have my little case because you get everything in your kit. You get all your little aligners that you need, you get your case that you carry and everything that you need to sort out your active aligners, which is perfect. And you carry it around, pop it in, and then you go to the bathroom, pop them back in. It's just simple and easy. And I think the ABC works perfectly in this process. So the next step is obviously with your bleaching your teeth, which I think is a fantastic way to go about it because I take it as like a celebration.
Yeah.
So you've been through this whole journey with straightening your teeth. It's quite an emotional journey too because I think a lot of people just take it as cosmetic, but there's a lot of changes that happen within someone's
Self-improvement, right? And it comes on different levels.
Yeah, and it's not just cosmetic. It's not just how do I look on the outside? It is, how do I project to everyone else my confidence, how you smile.
It's a transformation.
Yeah, and I feel that this is like a worthwhile treat. I wouldn't even say it's not a treat. It's like a pat on the back for like taking that step, going through that process, being diligent with it.
So just talking about, so now we're at the smile bar to do the whitening, because this is the recommended process where you align your teeth and then we go into teeth whitening to get up to that really, get rid of any organic stains you've acquired over this time and to just get your teeth to that really nice natural state. But just talking about what you said about, you can go and buy something over the counter. I think when it comes to teeth whitening specifically, because there's a abundance of different, much cheaper treatments. You can literally buy it at any pharmacy. So this is what's really nice about the Smile Bar as well, is because not all whitening treatments are good for you. And yes, you can get some things that are, a lot more affordable, but it's like I always say to patients, it's like buying a box hair color versus going to a salon and doing it professionally. The impact it has on your hair. So similarly with your teeth, it's about the quality of the products that you want.
Exactly, that is 100%. I've always been very skeptical of those over-the-counter bleaching products, only because my teeth are a major investment to me, and not just for now, but for 20, 40 years' time. And those over-the-counters, you are doing it at home. You have not got a professional to tell you how long, what damage it could be doing to your teeth, and which makes me nervous because at least somewhere like here, I've got someone that has years of knowledge behind them. They know exactly what products to put on. They're the whole I mean, listen, those products that come over the shelf, they don't put that stuff over your teeth. I don't know what you call it now. What was that thing where you stop? Because it makes like, what do you call it? Like pores or...
Oh, NanoSeal. So talking about the NanoSeal, I'm glad you brought that up because it is quite a big differentiator that we have at the Smile Bar. Because a lot of times when you whiten your teeth, whether at a dental practice or wherever, you're often more prone to staining. So you're not allowed to have coffee or have anything for 72 hours because your pores enlarge and then stains get in more easily. So with the NanoSeal, it seals your teeth and you can just eat whatever or drink whatever you like immediately after your treatment.
Which is perfect, which you don't get in those over-the-counter products. And at least here at the Smile Bar, they've got all your records. So they know where you start with your color of your teeth. They know what your process is. And then when you need to maybe come back in a couple months' time or a year's time, all your details are here. So it's not a process of, is this right for my teeth?
Yes.
And honestly, I think everyone has that like vision in their head when they get their teeth whitened of that like scene of Ross from Friends. Do you know what I'm talking about?
Exactly.
He gets his teeth white, he's like, bing! And and like at least here, you know that like they've got your back.
Yeah.
That you're not going to walk out looking like Ross from Friends.
Yeah.
Where if you try that at home, you very well could like switch off
never
the
know.
lights, and who cares about load shedding? You got your teeth to
Just
sort
brighten
you out.
up. That could actually work for some people. Maybe. So you've had your teeth whitened already. It looks amazing. But what has the experience been like? I think a lot of people have seen, heard of the Smile Bar, but why don't you just talk us briefly about your experience?
I think when you walk in straight away, it feels like you're walking into like a beauty salon. So it immediately like settles you because you know you're coming in to like treat myself and give yourself that extra bit of zhuzh for the day.
Yes.
It doesn't have a medical feel, which is really nice.
Yeah.
So it doesn't have that intimidation factor, because I think if you're not used to aesthetics or having treatments or things like that, anything like that could be very like scary.
Intimidating.
And it's not. And I think the Smile Bar has done everything to try and make it as relaxing as possible for this type of procedure. And I mean, there is a little bit of discomfort because you are going to be sitting still for a certain amount of time, but it is totally minimized by having that Wi-Fi where you can then listen to some music, listen to a podcast, have the headphones on, so you kind of just switch off for some time and have some me time while you're getting it done. And it actually just goes by so quickly.
Okay, great. And then your results, are you happy with it?
Yes, I'm so happy. I think when you've had the aligners and your teeth have been misplaced, there's obviously a build-up and coloration that builds up between those spaces. And then once it's now in its new place, it's an opportunity to obviously brighten those areas and make them stand out more.
Yeah. Amazing. And then I also wanted to ask you, obviously you do a lot of videos, people, a lot of talking, and you watch yourself back. Now, how do you feel now versus before your aligner treatment?
So it's kind of funny. So TikTok has this new feature now, similar to how Instagram has, where it shows you video from way back when that you can repost.
Yeah.
And I saw one pop up the other day, and it was before I started my active aligner journey. And I was watching and I was like, oh my gosh, look at my teeth. Before, like, I would like reshoot quite a few times because I'd be very self-conscious about my bottom teeth that would show when I talk, and I had one tooth that would stick out further than the other, and I was like, oh no, now I have to reshoot this, or I'd have to retake the picture because I didn't want it's so silly. Like, people go, well, everyone has, lots of people have skew teeth, but it was just like something for me that was I was so proud of my teeth being straight that when I saw these bottom teeth that weren't, it threw me off.
Okay.
So now when I'm doing my videos, it's like I don't even think about
No
that.
retakes.
No retakes regarding my teeth. Maybe my dance moves if I'm trying to do a dance, but other than that, my teeth are just like shining bright. And how many compliments I get about my teeth
amazing.
is
and
incredible.
Now that they're white and straight and in a row, get it?
Yeah, in a row. I see that all. Oh, good one. They're 100% in a row now.
I'm going to call the segment In a Row.
Yeah.
And, obviously, because you deal with a lot of people and you're in the public eye, what do you think, why do you think a smile is important, a good smile?
Well, for me, I think first impressions count. So whenever we first meet someone and we smile, unfortunately, that's just human nature. We create a whole life story about someone just based on their smile, their look and feel, and we judge them based on it. It's not great, but we do it. It's natural. It's a human thing we do. So for me, a great smile is a great first impression. It opens you up to a person and it makes you have a good impression of them.
Yeah. And I think it's also with whether you're looking for a partner, whether you're in an interview for a job, like all of these things are different aspects of your life. It's so important to make that first impression.
Yeah, I think a smile, it doesn't matter what you look like, what you dress in, but a smile can make a big difference and
There's that saying that says a good smile is always in style.
Exactly.
Yeah.
So it doesn't matter if you're in your pajamas, But if you walk out and you're beaming with that beautiful big smile, you can make a big difference in people's lives.
Okay, so now we're on to C. Let's see if she knows what the C is.
So I might get it wrong. Okay, guys, please. Okay,
Close.
composite bonding.
Composite bonding.
Yes.
Okay, so
3
the
points.
composite bonding is basically just going to smooth out your edges. So
Yeah.
you're going to have straight teeth, they're white with smooth edges.
With the composite bonding, I obviously had my teeth filed to help with the movement with my active aligners, and that's where the composite bonding is going to take place to like perfect my teeth,
Yes.
which has been really exciting.
No, amazing. And I think just to close, we just obviously now you've had active aligners, you've come to the smile bar, you're almost at the C part of it with your composite bonding. Overall, what would you think about, would you recommend this treatment? And I know you've raved about
Yes.
it, but just to like, to say overall, would you recommend it, or what advice would you give people considering either having aligners or coming into the smile bar?
So for me, active aligners, I think, is a choice where you determine, is this right for my lifestyle? And how quick do I want to see results? What are my teeth's needs? And would this be something I could easily fix? And it's also something you can have at any age.
Yeah.
It's not like, I think a lot of us, we reach a certain age and we're like, well, I'm in my 30s, I'm in my 40s, I just have to live with it.
Yeah.
Which is not true. And I think we also perceive teeth to be just aesthetic, where there's a lot of health benefits to having your teeth lined up properly, from breathing at night, the way your tongue lies. It all plays a part. And for me, active aligners has been an easier way for me to have my teeth straightened without having to go for that route where, to be honest, I was quite traumatized with my braces. I'm not going to lie. But I mean, I was young. And the thought of having that ever in my mouth again.
But there's been such a increase in adult braces, or like people now, obviously maybe due to affordability, or people like now, okay, they want to have their teeth straightened, but they don't want to do the metal root. So this is why something like an active aligners at Family Dental Care will be such a good option for those people.
Yeah, and I think also if you don't want your lifestyle to drastically change. So if you're accustomed to eating a certain way, or you don't want as many dental visits, because you don't need as many dental visits as you do. And obviously, I think the cost is a lot less.
Yeah.
So going to see an orthodontist is a lot different to going and seeing your dental practitioner in his offices. It's a lot different, the journey. With active aligners, you choose, it's your choice how well you do or not do.
Yeah.
And with wearing them, I mean, you have to wear them, I think it's 22 hours of the day. So you literally eat, brush your teeth, put them back in, and you're on your go. So I didn't have to stop and think, well, what am I eating today? And I think one of the questions I get quite often is it painful? Is it sore? So there is discomfort. Literally, first day or two, a little bit of discomfort, but it's nothing crazy. Like, I remember when I had my full braces, I couldn't eat certain foods. I had to eat soft foods for like a whole week.
Pain. I just remember
it was extreme
I also had a lot of pain.
I literally took 2 Panados, and I was like, I was probably just being a little bit of a wuss, to be honest.
No.
But it was like, it was perfect.
Yeah.
Like, and then it just, honestly, it feels like it was yesterday I was in the offices, and today I'm here and my teeth are straight. And I can barely remember who that person was.
Yeah.
I have to go and look back at those pictures and go, I cannot believe that was actually me. But I also think it helps with like Dr. Govender. He was very informative of every single.
You're one of his favorite patients.
We chat about the biggest load of nonsense every time I go, which is, I think, so perfect to make you feel calm.
Yeah.
Because I had to have one filling before we went on the active aligner journey, because obviously you have to have your fillings done and everything to make sure your teeth are great. And I hadn't had a filling for so many years. I think I've got 2 fillings in my whole mouth, and then that's it. So I was so nervous about the injection. Like, you know, I was like, oh, I'm so nervous about the injections. It's going to be so sore. And I hadn't had my mouth injected in so long that the last time I did, they didn't have numbing cream. So I had expected this whole injection to go in my mouth, and I was going to be like, and he goes, no, we put numbing cream on your gums now. You're not
It
even
was
going to.
that far back.
Yeah, because my teeth, I never have fillings. I have great teeth
Very
today, guys.
good.
And so I was like panicked. I was like lying there on the bed. I'm like, oh, the needle's coming. And he's like, I'm putting the numbing cream on first. You're fine, okay. So he puts it on. I didn't even feel it. I was like, I cannot believe I was sitting there like clenched, like waiting for that
It was
injection.
over before you knew it.
Exactly. I was such a ninny.
Yeah.
And he just had a good giggle at my nerves. But he has such a good way of of making you feel calm. Because I know everyone builds up this thing about going to the dentist, and it can be so. I mean, I'm so appreciative of family dental care group, especially with my kids when they've gone, because they haven't got the stigma that the dentist is a scary place, because their first experiences of sitting in a dental chair has been pleasant and relaxing and pleasant people that make them feel like this is just what you're supposed to do.
That's also something that, well, as family dental care, we really try to bring in. And I think you asked me maybe many years ago, you know, what age should I bring my children in? And I was like, as soon as they can, as soon as they've got their first teeth, because it is about getting good habits and not creating this massive stigma about the dentist you're only going to a dentist when you have pain, or it's about going in, being proactive, and children also need to understand it's not a scary space.
Yeah, so I've become one of those like moms that like when people are like, oh, I don't know when to brush my kids' teeth and stuff. You brush them when they have gums. I learned this already. Gums. You get those little finger things and you get those gums, because that's where like the habit. And my kids. Okay, I'll tell a little story. So yesterday we had a family bar at our house, and I was chasing them to get ready, and I was like, I've got your toothpaste ready, go brush your teeth. I had to chase them out of the bathroom because they were brushing their teeth for too long. Because they just love it. They'll say, get out the bathroom. You're already late now. Your teeth are perfect.
Perfect.
And that is your advice, like of making it into like a habit from young, is the perfect advice.
Amazing.
Because then it's not something that's like, oh, don't brush my teeth. No.
Okay, so great. So kids sorted, teeth sorted, perfect, ready, camera ready.
I'm going to keep on doing this all day. I'm just telling you.
It's been an absolute pleasure chatting to you, Teri. I think that's all. We're so happy that you're happy. We're all about patient satisfaction. And you've just been so great during this journey and during this interview. Any last thoughts?
I just think if you have the ability to have something like this done, whether it's active aligners or coming to the Smile Bar, make an investment in yourself. You will be shocked at the advantages it gives to your self-confidence, to be able to walk up to someone with a smile that you're not hiding. I think it is so sad when we laugh and we smile and we want to cover our teeth because we are embarrassed. I don't think we should hinder our life for that. I think we should laugh and smile freely. And
yeah, well, I think you've heard it from the horse's mouth. It's all about investing in yourself for your future, and for just to live a better quality of life. So thank you very much for being here in the pod.
Thank you.
And we'll see you in 6 months' time for your top-up session.
Cool.